I'm Nancy Spears with genConnect.com, and today I'm talking to Shwen Gwee, who's Vice President of Digital Health at Edelman, which is one of the most trusted communications brands in the world. And Shwen, nice to meet you.
Nice to meet you too. Thank you for having me, Nancy.
You're welcome. Healthcare is a big topic, but I know that you're a specialist in healthcare and social. And I understand you just wrote in your new blog an article on 6 Ps of new health. Can you tell us what that is?
It's actually the 6 Ps of social health,
Okay.
which really is something that I wrote coming out of an unconference that happened in September this year.
Mm-hmm.
And really what the key themes are is where I see health trends going based on the conversations that happened during this conference that was run. And so the 6 Ps are personalized, participatory, preventative, portable, peer-to-peer or patience, and passion. So I'll
Okay.
describe that a little further.
Great.
Personalized. The way medicine is going these days, it's becoming more and more personalized. Everything from our diagnostic tools and medications are becoming much more personalized in the sense that there's things like gene therapy and diagnostic tools that really look to the individual level to understand how it affects you based on your genetic components. So it's becoming much more personalized, but also in the information that people are getting, in the way that they're consuming information from websites. It's all being very much more customized now because of the way that the digital and web movement has sort of created the ability to deliver customized information. So that's sort of the personalized aspect. In terms of participatory, it's much more a hand-in-hand work together to get the best outcomes for the patient. That's the way things are going these days. It's no longer doctor tells patient, patient does whatever they say or not. And it's no longer about a one-way conversation. It really is about different parts of the healthcare spectrum helping the patient, who is at the center of everything, get the best outcome at the end of the day, because in the end, the patient is the main focus of healthcare, treating the patient, so they need to be the center of everything.
Sure.
The third one is preventative. So that is really speaking to the fact that a lot of us are thinking about preventative medicine these days, not just curing once somebody has a disease, but helping somebody prevent getting the disease. So I think in America, one of the biggest epidemics that we're all talking about these days is obesity. How do we what preventative medicines do we have to help people not get to the stage of obesity? So that's sort of an example of how preventative is becoming a big part of healthcare these days. The next one is portable. So portable really meaning mobile. There's a big tsunami in healthcare these days, and it's called mobile. What we're seeing is that more and more people are consuming healthcare information from mobile devices. They want it as, when they want it, where they want it, how they want it, at that point, on demand, exactly. And it's all very easy to do these days because of the devices. We all carry around this phone in our pocket that has so much power that it can pull up so much information anytime you want. So is your health information ready to be delivered in that format? It's an important thing to think about. And then the other one was peer-to-peer or patients. Again, patients are at the center of everything. All of healthcare should be centered around that as the main focus, because we want to get the patients to the cure or to the best outcome possible. So patients are no longer just sitting back though. They are rising up and taking charge of their own health. They are moving forward with trying to share information with each other or to learn from each other, and they're speaking out loud and sharing things online and connecting with each other in a way that have never been possible before because of things like social media, which have allowed the ability for people to publish anything they want and really have a voice. So that's sort of the peer-to-peer and patient component. And then the final part is passion. Now there's a lot of people trying to do things these days, but so far from what I've seen, the most successful sort of initiatives have come from people who have developed it out of pure passion. Whether it's somebody who has launched a patient website, community website, because they had a relative who had a disease, or whether it's somebody going out and speaking very candidly about their experience. It's usually all driven by passion. And the message to people who are in the health business is tap into that passion. Don't just try and cut them off because they're not saying what you want them to say. How do you leverage that passion, harness it, and then release it in an amplified fashion. So passion's a big part of this because health is such an important and close aspect to every one of us.
Fantastic. So it's clear that you're very passionate about what you do.
I am.
And good news for patients in terms of a bigger voice, a bigger conversation, more resources. It's a brilliant template, and so congratulations on that. And you can meet Shwen and learn more about the template or listen to this again at www.genconnect.com. And you can also find Shwen Gwee at Edelman.com.